My name is Greg Remke. I direct programs for economic thinking, a nonprofit that does workshops for high school and homeschool speech and debate students on the economics of their national debate topics. This year, the STOA Homeschool League has a topic on federal healthcare reform, and I'm working with Ziggy Debate to try and stage some online debates on leading healthcare reform proposals. The first one I recommend draws from the Make America Healthy Again project that Robert F. Kennedy Jr. brings to the administration. And I'm calling for reforming the standard of care for obesity, diabetes, cardiovascular disease. So federal health care system has programs for Medicare, Medicaid, for veterans, federal prisons, military, school programs. And in all these, they have particular policies, sort of public health policies and health policies that aren't backed by evidence and critics say have caused the epidemic of chronic disease that afflicts the majority of Americans in one way or the other. So it's a pretty big topic area, but I haven't yet found STOA debaters running this as an affirmative, which is to me is sort of puzzling. So I'm going to try and explain where this is coming from. It's not a right-wing, left-wing issue. I've got the Make America Healthy Again hat in blue, although you can buy them in red. I've got Spock of Star Trek, Live Long and Prosper. I'm not sure how long the Vulcans lived, but I'm sure there's Trekkies that know. I'm going to draw from a book called Biochemical Individualism by Dr. Roger Williams of the University of Texas. So off we go. So each year I do workshops on the debate topics, discussing and recommending books and ideas on the economics, mostly market economics, for reforming these policies. Energy policy was last year, healthcare this year. Last year I made the case that federal energy policies were promoting intermittent energy, wind power and solar power, which have many advantages and are getting better year by year, still have problems in that they're intermittent. They have to be matched with batteries or some sort of other energy storage to provide the reliable energy that our cars, our houses, our factories need. And the grid is getting progressively more fragile as federal subsidies are pushing more and more subsidies toward wind and solar. Now, for the healthcare topic, I'm arguing, other books listed here, federal policy is similarly promoting intermittent energy policy, is promoting carbohydrates that have a tendency to overload our system because we're unable to store carbohydrates long term without putting them into fat cells and causing metabolic health, insulin resistance. I'm going to talk more about that, but I think it's interesting there's sort of a similarity in federal policy promoting energy sources sort of unhealthy for the economy and also energy sources unhealthy for our bodies. And let me try and make the case that's true. I mentioned in my seminars and so forth the book Priceless by John Goodman, recommending health savings accounts, medical savings accounts. Also Recovery on the right here from the Cato Institute on sort of economics books, promoting reforms, and then Blind Spots, and then two books that are on metabolic health, Why We Get Sick, focusing on insulin resistance, and Change Your Diet, Change Your Mind by Georgia Ede, that's making the case that our sort of chronic mental health challenges, anxiety, depression, more severe mental health problems are tied to problems with brain metabolism, brain energy, which is relevant. Other resources, Nutrition Coalition, focusing on changing the dietary guidelines, Metabolic Mind with research on metabolic health, metabolic mental health, and Goodman Institute, others I recommend. So recent posts, here's one, it was on X. A doctor said only 10% of diabetics can actually reverse diabetes and sustain its remission by changing their diet. It requires medication. Dr. Unwin, GP in the United Kingdom, with a couple thousand people in their practice. They've recommended reducing carbohydrates to their type 2 diabetics and found that some 50% of them who reduce the carbohydrates are able to deprescribe for all their medications and put their type 2 diabetes into remission. And they've published these results, and others have published similar findings. So which is it, 10% or 50%? Doctors apparently disagree. Similarly, you find in Congress for federal health care, over 100 congressmen have voted for making Ozempic, a GLP-1 drug that is injected to reduce weight and diabetes, $1,500 a month. They're voting for that, but that has healthcare consequences we don't yet know. Here's a young singer who was trying to lose weight, prescribed Ozempic for over a year. Now she's trying to get off Ozempic, and she finds that her health is permanently damaged. She has chronic conditions, bone thinning, osteoporosis, things like that, that apparently are irreversible. So again, status quo says if you're obese, struggling with weight, type 2 diabetic, here's medications, here's bariatric surgery, here's other things that we can do to deal with the symptoms, instead of just letting people know, reduce carbohydrates. Have bacon and eggs for breakfast instead of oatmeal. And that for a lot of people, for again, 50% in Dr. Unwin's study, allowed them to come off their medications and reduce diabetes. So shouldn't this be the standard of care the federal government offers in Medicare, Medicaid, veterans, military, school lunch programs, and so forth? So I post on this on normalnutrition.org, Reform Standard of Care, and I lay out the arguments for this and cite evidence. And then I wrote a similar article on economic thinking, making the same claims. In the post on Normal Nutrition, I mentioned a company, Toward Health, that is using this for companies where they go in and offer their employees this same advice, Leotrim, Swiss Re, other companies, and they find that some 50 employees lost an average of 43 pounds, total of $83,000 in savings, 96 deprescribed medications. You have to be careful deprescribing when you change your diet to change your metabolism. So what if we could get healthy from this epidemic of chronic disease by changing what we eat, and measuring a continuous glucose monitor that allows you to measure your blood glucose levels after you eat, because people are different. So I have a handout on this that I make available at STOA debate tournaments. Often they go in with the ballots for students after, citing these studies. And Dr. Unwin's was in The Guardian here with his. In the article I write on Normal Nutrition, I cite the evidence, particularly for federal health care and Medicaid, which is, and Medicare, they're, bankrupting the country because their costs are escalating so rapidly. Here's a case where two companies, Ona Health and Essen Health, basically one has offers Medicaid care in the Bronx for low-income people in the Bronx. People would have a long wait, months-long wait to get even to see a doctor for their severe type 2 diabetes. They now have an option to sign on to Ona Health. It was originally a pilot program, now it's an official partnership. And in the case of one lady, her type 2 diabetes poorly controlled, she's way overweight, insulin shots 3 to 5 times a day, dizzy, vomiting, severe headaches. She goes into the separate program where they basically give her a continuous glucose monitor, educate her on how she can reduce her carbohydrates, eat healthy fat and protein. And in her case, she came off all her medications fairly rapidly, lost a lot of weight. 8 months later, no medications, 30 pounds less, off 15 medications. And, it's not from joining a gym and super exercise or, going hungry. She just changed the food she ate. eats. This should be the standard care for the entire federal government healthcare system, for all the avenues, and in public health, right? This is the opposite of what the federal dietary guidelines recommend. They say eat lots of carbs very often and cut back on meat and fat, saturated fat. So change the standard of care that the federal government offers Americans. This is a federal health care reform that is on the basis of draw from the new evidence for people that are metabolically ill, some 80% of the population, explain to them what the problem is and how they can resolve it. So I've discussed these ideas in past presentations, Liberty International in Madrid, this nutrition against disease, using food as the best approach to resolve chronic disease. I talked about money policy and food at an economics conference, healthy ways to liberty, measuring metabolic health. This was a talk at the NIHD camp, and then also later at the civic forum that the Institute for Policy Studies did in Hayward this year. And then I talk on agriculture and regenerative agriculture, because our food has less dense nutrients, which is part of the problem of our nutrient poor diets. So here again, public choice is sort of looking at the concentration of benefits, diffusion of costs, as special interests distort federal policies in energy policy and in health policy. So again, the intermittent energy, wind, solar, geothermals, and nuclear are reliable, but wind and solar getting the most of these federal subsidies, promoted by people who benefit from it and people who ideologically, almost religiously believe in it as a way of reducing greenhouse gases. You could argue they'd be competitive if they developed organically through market processes, but these subsidies have dramatically distorted the pace and the design of the systems and made the grid fragile. We have this tangled mess of political subsidies and top-down green projects and regulatory overreach. And of course, the fossil fuel industry is subsidizing or is promoting their fuel types and pushing for increased tax deductions, just like the beef industry and dairy are in the health world. From outside energy, go to inside energy, our body. Similar story, the government for 50 years is promoting intermittent, sort of less healthy energy sources, which are carbohydrates, fruit, vegetables, grains, whole grains, or any grains, because they turn to glucose in our bodies and lead to this boom and bust of glucose in our bloodstream that's problematic and unhealthy for us. So public health officials advise and mandate excess grains and other carbohydrates, plus seed oils, and one drives insulin resistance and the other inflammation. So we have increasingly fragile electric grid, and most people have a fragile metabolic grid, and we have an epidemic of chronic disease because of it. So books on this, Good Energy by Casey Means and her brother Callie Means, seem to be very influential in the new administration. Now, how did we get into this problem? We went from panic to panic public health policy with the federal dietary guidelines. Dwight Eisenhower had a heart attack in the 1950s as president, and there was a lot of heart attacks in the 60s across America, and something was driving it. Ansel Keys argued it was saturated fat that was clogging our arteries. He did 7 country studies that shows the 7 countries with the least saturated fat had the healthiest, the least amount of heart disease. But it turns out he originally did a 22 country study and left out the countries that didn't fit his theory. But we got the federal dietary guidelines, the food pyramid, with the McGovern Commission that held hearings in the 1980s. And though there was scientific resistance to this, particularly by John Yudkin, a leading researcher who said sugar was the problem, excess sugar, you have McGovern in the hearings saying, we don't have time for more evidence, people are dying. So they passed the federal dietary guidelines that blame saturated fat. Evidence didn't support the food pyramid. They later changed it to a food plate, but it's still pretty much the same, calling for reducing saturated fat without significant evidence. And also, Dwight Eisenhower He was smoking 4 packs of cigarettes through World War II. So maybe smoking was the problem, and there was a lot of smoking that maybe contributed to heart attacks before people died of lung cancer. So was it excess sugar? Was it smoking? Was it something else? Or was it saturated fat? But we got locked into a system that argued against red meat and saturated fat and tried to tell people to eat more fruits, vegetables, grains, and whole grains, more servings each day. And that's been 40 years of federal public health and federal health policy from nutrition, even though doctors don't get much training in nutrition, which is maybe good since the nutrition training has been not good, in the nutrition departments at universities funded by food industry and pharmaceutical industry in part. So I would encourage you to look at the Nutrition Coalition that assembles research and is critical of each year's 5-year federal dietary guidelines that are still not evidence-based. The ideas come back in this with Gary Taubes' book, Good Calories, Bad Calories, arguing, for butter and against margarine, for saturated fat. And Nina Teicholz in 2015 with her book, The Big Fat Surprise, Why Butter, Meat, and Cheese Need to Belong in a Healthy Diet. Both Teicholz and Taubes are science journalists. They don't come at this as scientists, but journalists interviewing hundreds of scientists and trying to figure out what the research shows and how we got these policies that aren't backed by quality research. And again, this is for debaters to try and find the best arguments on both sides and improve our federal policies. So here's an example. We have an epidemic of obesity, type 2 diabetes, as well as cardiovascular disease. And here are the associations that are supposed to help us. The American Diabetes Association in the US, Diabetes UK in the United Kingdom. But Diabetes UK and the American Diabetes Association are telling people to eat carbohydrates, to eat whole grains, and cover them with your insulin, which is the advice my father got when he was diagnosed with type 2 diabetes, the advice that most people get in the current standard of care. If you're a diabetic and go to the hospital for any reason, you get the diabetic plate, which is full of sugar and carbohydrates and would spike your insulin, except if you've got an insulin pump, you can try and cover it. Instead, if you've got type 2 diabetes, don't eat carbohydrates or eat much less. The less insulin you get in your body, the better. So diabetes.co.uk, here's a picture of David Unwin there. They give pretty much the opposite advice of the main Diabetes UK website. They say, monitor your blood glucose levels, try and keep them stable. They're going to surge when you exercise or when you're stressed. But if you eat, a plate of pasta or bread or rice, and it causes your blood glucose to surge, then, don't eat that. Or eat your food in different order or different times or smaller helpings. But if you eat an egg or bacon and eggs in the morning instead of cereal, chances are your blood glucose levels will be more stabilized. Government policy says eat a big breakfast, but for a lot of people, breakfast is the most dangerous meal. They shouldn't be eating breakfast because it spikes their blood glucose levels and helps them get type 2 diabetes. That's what Terence Keeley writes about in his book, Breakfast is a Dangerous Meal. So, and then there's the American Diabetes Society in the US, which is the alternative provider saying, if you've got type 2 diabetes, cut back your carbohydrates, do what you can to stabilize your blood glucose levels. Insulin, exogenous insulin, as a last resort, monitor your hemoglobin A1C, which is a 90-day average of your blood glucose levels, but find out what your body works for your body. Obesity Week is a mainstream companies that provide mainstream metabolic services, drugs, surgery, medications, other medications. Here's Dr. Terence Keeley giving a talk on his history with type 2 diabetes. And he's saying, look, a lot of this modeling is a problem, whether they're climate models, and I'm saying this, climate models, financial models, pandemic models, with faulty infection fatality rates. Well, now we have modeling for healthcare. So the federal dietary guidelines use models to try and show that we need to reduce carbohydrates. Nina Teicholz argues these nutrition models are the worst. They're a series of modeling of models, of epidemiological models, and they're not reliable. So a book, Escape from Model Land, discusses this. And again, Terence Keeley's book on his experience of having type 2 diabetes, even though he'd followed what the UK federal dietary guidelines were. The guidelines are the cause of the problem. Federal healthcare policy is the cause of the epidemic of obesity and diabetes and mental illness, cardiovascular disease, according to sort of the metabolic health community. So I write about this in a paper for the Goodman Institute, drawing from Nina Teicholz, Gary Taubes, David Ludwig, explaining this sort of story, trying to reference the different claims. This article in STAT, the American Journal of Clinical Nutrition, argues that the problem was the model that the public health and doctors had, which was obesity was caused by an imbalance of calories. Calories in, calories out. If you consume more calories than you expended, you gained weight. The sort of thermodynamic metaphor. But in fact, that's not the problem for most people, according to Dr. Ludwig and co-authors. Instead, it's carbohydrate insulin model. It's a problem with fuel partitioning. Some people eat food and they can't burn it in a stable way over time. Instead, they have cravings an hour later. High carbohydrates, there's no place to store carbohydrates. I mean, it's in your bloodstream a few teaspoons, then some in your muscles as glycogen, some in your liver, then you're full. Then insulin surges out to remove the excess glucose from your bloodstream, pushing it into your fat cells. Over time, that gets harder and harder, require more and more insulin, which is why you need not just a blood glucose test, a fasting blood glucose, but a fasting insulin test to see how high your insulin levels are. But over time, insulin can't manage this anymore. Your cells get insulin resistant, and then you're pre-diabetic and soon diabetic. And that's the path tens of millions of Americans are on. So the background of this, the problem is with the eat less, exercise more advice. It doesn't work for most people. They say, doctors who say obesity is just overeating, that's like saying, alcoholism is overdrinking. Sure, but what's causing it? What's causing people to get madly hungry and cravings? It's the kind of food they're eating, not the amount they're eating. People have willpower, but there's a problem with trying to use willpower to lose weight. You can, doctors say, well, just step back from the table when you're 80% full, when you're not quite full. If you do that over time, you can lose weight, but you're signaling your body that there's not enough food. The body doesn't know. It thinks that there's starvation, lack of food, so it downsteps your metabolic rate, so you'll burn less energy even when you're not exercising. And that leads people to feel miserable, cold, and the next month, they gain weight on the same amount of food they lost weight on last month because they've got a reduced metabolic rate. So you want to keep your metabolic rate going. You don't want your body to think it's starving. You should eat till you're full at every meal. You don't want to overeat, and you want to eat the right foods, but you don't want to leave the table hungry. You don't want to, for parents, you don't want to tell your kids to do that. It's dysfunctional and problematic. There's books on this called Intuitive Eating or Don't Diet. But you don't want to take the advice of the diet network of counting calories. Those don't work for most people. You want to be satiated. So maybe you want to find out which foods, like when I eat an egg, I'm not hungry for a long time. And it's nutritious. It's got healthy fat and protein. So eggs are a good thing for me. And they're a good thing for a lot of people who aren't allergic to them for some reason. So everyone should find out what foods fill them up and then are nutrient dense, are healthy, full of the calories, the amino acids, the nutrients they need. But it's the energy balance theory that's the source of the problem, and that is what the government and doctors and the federal healthcare system still drive because it's baked into the system. It's the federal guidelines and federal standard of care. So for debaters, you can advocate a reform to this, and we will save billions of dollars and have much healthier people. We'll balance the federal budget because our Medicaid and Medicare and Veterans Administration won't be swamped with expenses and unhealthy people. So this is not a fringe idea. This is very popular, especially in the last 5 to 10 years. David Ludwig at Harvard Health, Eric Westman at Duke, Mark Hyben at Cleveland Clinic, Stephen Finney at VertaHealth, and many, many others. My post on this, Help Americans Get Healthy Again. I'm just mostly citing other people on this and researchers. So the federal government has had these theories. They spent huge amounts of money trying to get data to support it, and they haven't, and they have suppressed alternate evidence that shows that their guidelines are wrong. So to find out more about this, I'd recommend the Society of Metabolic Health Practitioners, and it's lots of practitioners and standards of care for type 1 and other medical conditions. I attended the Symposium for Metabolic Health in Boca Raton. I was involved in a pre-conference that Toward Health did, where my story was shared, how I watched Nina Teicholz speak at the Cato Institute and gave up eating breakfast. I was eating Raisin Bran thinking it was healthy, but it turns out like 17 grams of sugar per serving plus the grains in the Raisin Bran. I switched to having bacon and eggs or just not eating till lunch because I wasn't hungry. That turned out to work for me. I lost 20 pounds in April 2020, another 20 pounds over the next 6 months. My weight went from 231 to 192, 195, and it stayed that weight for 5 years. I go up and down a little bit, but it's not discipline, it's not hard work, it's not hard. I just stopped eating bread, rice, pasta, but I still eat food I like. I can eat a cookie when I want, and I can eat bread if I want, sourdough bread. But my focus should be on stabilizing my blood glucose levels. Sometimes I'm fasting now, and that's an interesting experience for me. But there's a lot of sources on this. People disagree. This guy, Nutrition Facts, he's, I think, a vegetarian, and they're promoting a plant-based diet. But there's a lot of influencers. I was interviewed recently on the Low Carb MD podcast. As of March 12th, my episode hasn't run. Maybe it's so bad they won't run it, but presumably it'll be up sometime and I'll share it. I talked about this being a debate topic, but I learned a lot from listening to the Low Carb MD podcast, Life's Best Medicine podcast, and many other metabolic health podcasts over the last 5 years.